This masculine aging thing, which is the natural decrease of testosterone, this happens even to like the healthiest guys.
What is called androgen deficiency in aging male.
This
This is
is
called ADAM.
this is natural, right?
This is natural.
So talk about it starting from my age, 30.
Yeah. So
Uh,
we'll talk about
what's
it.
happening in my body right now.
So we have a person who has been exercising, who has been looking at his muscles. He has a certain testosterone. And slowly, because all of us are expected to get into our routine work, which does not involve exercise, unfortunately. So, what happens is that the testosterone, because as we have menopause in women, there is something called andropause in men. The only difference is that in menopause, you have a clinical sign of cessation of periods, whereas in men, there is no clear cut sign and it is a gradual process. For example, what we believe is that illnesses, so you get into an injury. Suppose some boy gets into an injury at 30, he is bedridden for say 10 days. His muscles are not used for 10 days. His basal testosterone level falls. Then he goes for rehab. Everybody doesn't go for training as you see in certain movies where somebody has got a blade and is running and whatnot. Everybody goes back to work, office perhaps. So they don't bother. So suppose your testosterone was say 600 nanograms per ml and you have been in bed for say 15 days because you had a fracture or you had a fever or typhoid or a viral illness which was prolonged.
Or you're just burnt out because of work.
No, I'm talking about a very specific thing, injury to the body,
Oh,
which
okay.
reduces your physical activity.
Fair. Okay.
So when your physical activity is reduced, your testosterone consumption is reduced, your basal testosterone level falls. So your testosterone was 600, you get hit by a car, you get into a hospital for 6 weeks. When you wake up when you get out of the hospital, your basal testosterone is supposed say 400. Then you start coming back to work. You are not rehabilitating as a physical activity but then you are good enough to go to office, so you start going to good enough to go to office. So testosterone may increase from say 450, from 400 to 450. It doesn't go to 600. So every single episode that occurs to us beyond 30 years of age brings down our testosterone to a level which is not recoverable.